Wash your hands. Proper hand hygiene is vital when it comes to preventing the spread of infectious diseases. Pathogens, such as viruses, bacteria and fungi, are easily transferred from contaminated surfaces to your skin and from there to your eyes and mouth where they can gain access to inside your body. Thus, washing your hands is one of the first steps to take to reduce the transfer of infectious agents. Wash your hands every time after going to the bathroom, changing a diaper, sneezing or blowing your nose, and when coming into contact with bodily fluids. Avoid touching your face, eyes, and nose. People tend to touch their face several times throughout the day. This is when the infectious agents in your hands gain access to your body. Where an intact skin does not allow transfer of pathogens into the body, the eyes and mucous membranes in the nose and mouth do allow this. Besides maintaining a proper hand hygiene, try to avoid touching your face, even with clean hands. Keep all immunizations up to date. Vaccines are a preventive measure that help prevent or lessen illness caused by infectious pathogens. They work by stimulating an immune response against a specific pathogenic agent, and, if you are ever exposed to the pathogen, your immune system can fight it more effectively. Get all adult and childhood immunizations on time and keep an accurate vaccination record at home for every family member to ensure everyone remains up to date. Stay home. When you are sick with infectious disease, it is important to limit exposing other people to the pathogen and spreading the illness. Although some infectious diseases do not spread easily from person-to-person contact, others do, and thus, you should stay home when you are symptomatic. If you are at public spaces, cover your mouth and nose with your elbow while coughing, and not with your hand, to avoid spreading pathogens airborne and transferring germs with your hands. Prepare and store food safely. Some pathogens can be transferred into your body via food, so-called foodborne illnesses or pathogens. Once food is consumed and the pathogen gains access to your body, it can multiply and cause illness. Thus, it is vital you prepare and store all food appropriately. Prepare your food responsibly by limiting cross-contamination. Raw food should never be prepared on the same surface as ready-made food to prevent transferring pathogens. Practice safe sex and do not share personal items. Sexually transmitted diseases, STDs, are spread when bodily secretions come into contact with your genitals, mouth, and eyes. Practice safe sex to limit your risk of catching an STD. Always protect yourself by using a condom or dental dam during sexual activity, especially if you are not in a monogamous relationship. Travel wisely. Be aware of the risks of infection that increase when you travel. Some infections may be more common in places you are traveling versus where you live. Talk to your doctor about important vaccinations to get when you are traveling. This allows you to build up your immunity and be more prepared to the native pathogens present at the areas where you are traveling to. Understand different kinds of infectious diseases. You should be aware of the different agents that can spread infection. This can help you manage your risk factors. Bacteria are the most common infectious agents. They can be transmitted via bodily fluids and food. They are single-cell living microorganisms that use your body as a home base to replicate. Treat bacterial infections with antibiotics. Antibiotics are medications that fight off bacterial infections. They work by disabling or killing bacterial cells and thus fastening the elimination of bacteria by your immune system. Use topical antibiotic ointments for small wounds that are infected. Signs of infection include redness, swelling, warmth, and pain. Do not use antibiotic ointment for heavily bleeding wounds that are deep. Seek medical attention if you have a wound that does not stop bleeding. Treat viral infections. Viral infections cannot be treated with antibiotics, but there are some antiviral medications that can be used for certain viruses. Some viral infections are treated with at-home remedies, such as rest and remaining hydrated. Some drugs, known as antiviral or antiretroviral drugs, can fight off certain viruses by taking away their ability to reproduce their DNA inside your cells. Know how to treat fungal infections. Some fungal infections can be treated with medications that help eliminate the fungi and clear the infection. However, there are numerous pathogenic fungi that cause infections, and only your doctor can diagnose and prescribe proper treatments. Some fungal infections may be treated with a topical ointment if the infected site is on your skin, such as foot fungus. Know how to treat parasitic infections. As the name implies, parasites are organisms that hijack your body's resources in order to live, grow and multiply inside you. Parasites refers to a wide array of pathogenic agents from worms to microscopic cells. Many parasites can be transferred into your body via contaminated food or water, such as hookworm, while others enter via broken compromised skin, such as malaria via mosquito bite.